Hi, I'm Dr. James Machino, and I want to explain to you the science behind Adiva's glucosamine joint formula. This is a supplement that I formulated for Adiva Nutritionals a number of years ago. It contains glucosamine sulfate and 3 natural anti-inflammatory agents. Let's start with the glucosamine story. Something that you want to know about your body's aging clock. After the age of 40, your body stops making optimal amounts of glucosamine. Now, when you're younger, the body makes glucosamine, and glucosamine becomes the raw material from which your body can make cartilage to preserve your joint health. So the cartilage is actually the shock-absorbing pads between your bones. After the age of 40, an enzyme drops off and your body now makes less glucosamine than it did when you were younger. As a result, the rate at which the cartilage is breaking down is now faster than the rate at which you can synthesize it. So you start to get a thinning of your joint cartilage, the bones get a little bit closer together, and you're on your way to having cartilage erosion, which leads to osteoarthritis. Now, just about everybody, as they get older, if they don't follow the advice I'm going to give you, develops some level of osteoarthritis at some point as they age. So 80% of people end up with osteoarthritis by the time they're in their 60s or 70s. It's almost 100% of people are going to get it eventually. And that's because we didn't know how to prevent it before. There are many studies now that prove that if you put glucosamine sulfate back into your body to compensate for what your body's not making for itself, your body will take that glucosamine and use it to maintain your cartilage health and preserve your cartilage and even repair your cartilage. So that as you age, you're giving your body the raw material that it can't make for itself, and you're preserving this. I will tell you, the truth is there are no drugs yet that can substitute for this. So glucosamine sulfate is vital. And there's been a lot of debate in medical circles about the glucosamine research, but in the year 2012, in the journal called Therapeutic Advances in Musculoskeletal Disease, a review report, which was headed up by a major medical physician, basically told medical doctors it's time to start recommending glucosamine, not just any glucosamine. It has to be glucosamine sulfate. That's the only proven form of glucosamine that shows in the clinical studies to give the following effects. That is, it treats osteoarthritis. It helps to stop the further progression of any arthritic changes that have developed, and it prevents people who have some arthritic changes from, at some point down the road, requiring knee replacement surgery. So if you have arthritic changes, the scary thing is that eventually you lose all the cartilage, and then you have to have a hip replaced or a knee replaced. The only thing, as they say in the article, that's ever been shown to prevent that from happening is supplementation with glucosamine sulfate. No other form of glucosamine, and there are no drugs that can do it. Studies prove that that form of glucosamine helps arthritic patients. But I will tell you that after the age of 40, don't wait for the arthritic process to set in. It's going to. Start taking a low dose of glucosamine sulfate at age 40 and maintain that low dose so you don't get arthritic changes. All you need is about 500 milligrams of glucosamine sulfate each day, and it has to be that glucosamine sulfate form. Now, you should be taking glucosamine with anti-inflammatory herbs, so that's why I formulated glucosamine joint formula. Glucosamine on its own is fine, but there are other factors that lead to arthritic change and achy joints. So the glucosamine sulfate should be combined with bromelain enzymes, MSM, and quercetin, 3 natural agents. What do they do? Well, as we get older, on the lining of all of our joints, there's like a saran wrap there. And as we get older, the white blood cells that line the saran wrap start to secrete inflammatory chemicals that produce a mild, low-grade type of inflammation and start to irritate some of the nerves, and joints become a little more achy. Not just because cartilage is thinning, but because we're getting these inflammatory chemicals. So they produce a low-grade swelling, mild aching, the joints become a little more stiff, and if you have arthritic changes, it amplifies the problem by producing the inflammatory component. Quercetin, bromelain, and MSM are proven to decrease the secretion of these inflammatory chemicals and suppress some of the other inflammatory prostaglandin hormones that account for this type of change in the joints. So part of the anti-aging process is to preserve your joint function. You need glucosamine sulfate and you need the anti-inflammatory herbs. It's a very important quality of life issue. Because arthritic changes are not going to end your life, but it's going to make your life pretty miserable. As you get older, you'd like to be able to maintain joint function and health so you can keep carrying on and doing the things that you enjoy doing in life. When you combine glucosamine sulfate with the anti-inflammatory herbs, as I have done, you get a fast-acting product. So that even if you have some arthritic changes, it brings the inflammation down faster, you're feeling better almost right away, and the glucosamine is going to work on helping to repair cartilage damage that has been done to this point. And so it also helps you reduce your reliance on anti-inflammatory drugs. People say, well, if I have arthritis, why don't I just take aspirin or ibuprofen or indomethacin or Voltaren? I'll tell you why. Because if you take too many of those drugs, it's going to cause gastric irritation, stomach irritation. It can lead to ulceration. Those drugs can lead to internal bleeding. They can lead to liver damage and kidney damage, and some even cause cardiovascular disease and raise blood pressure. I'm not saying that you can never use those drugs. I'm saying over your lifetime you want to try to minimize your use as much as possible because of the adverse side effects that are so well documented. So the way that you do that, one of the ways that you do it is important. Exercise is important, a healthy diet's important, staying at your ideal weight's important. But as part of that, at age 40, you take 1 to 2 capsules a day of glucosamine joint formula. If you already have some osteoarthritic changes, you're going to need 3 capsules a day, maybe even 4 capsules a day to help manage the condition and reduce your reliance on anti-inflammatory drugs. I will tell you that taking glucosamine joint formula after 40 will really pay off in spades for you. I started doing it in my early 40s, and I can still run and lift weights, do all the things that I was able to do when I was younger without any kind of major joint problems. So an ounce of prevention in this case is truly worth a pound of cure. So I hope you'll take this advice to heart, and thanks so much for watching.